Everybody, my name is Dr. Roni. The topic of this video is peripheral neuropathy, and more specifically the causes of peripheral neuropathy and the solutions. And we're going to really isolate the solutions for you so you can understand how you can heal, okay? The other objective here is we want to explain the different healthcare paradigms and models so you understand each approach and how to utilize them, especially for peripheral neuropathy. We're going to be able to get you better by increasing your function and getting rid of the causes to your neuropathy. So I want you to keep that in mind as we work through, okay? All right, so the mission, teach and motivate people to live a more pain-free and quality-filled life, but we want to use the most researched and advanced functional and integrative medicine procedures, protocols, etc. Okay? So I'm going to explain that, and you'll have a better idea as we move forward of what I mean by that. In short, we want to teach you, right? I've worked with neuropathy patients for a long, long time. I know you want answers. I know a lot of you aren't getting answers. So this is primarily for you to be able to get more answers. If we can help you in any way, you may need help walking through this process, as you will see, feel free. But in general, it's designed to help you, okay, so you can navigate how to get your neuropathy better, okay? All right, so qualifications, I'm not going to harp on them, but I do want to tell you a quick story, my background briefly. I started in sports medicine and athletic training. I then worked in hospitals doing rehab. Then I got a chiropractic degree. So what I did early in my career is integrate all of those, the rehab, the sports medicine, the chiropractic, the modalities used in physical therapy. And we did a good job of getting people better, but there was a segment of my population of patients that I had that just weren't improving. So with that though, their charts started to look very similar. These patients would have issues like autoimmune conditions, thyroid malfunction, they would have gut or digestive issues, hormonal imbalances, etc. They had a lot of issues familiar to one another that were not allowing their bodies to function well, which means they were kind of unhealthy. And because of that, they weren't able to heal. So I went back to school for years and years and years, trying to understand some of these issues that were creating chronic pain, chronic fatigue, etc. Okay? And so this presentation will help you understand accumulatively what I've put together or what I've learned to be able to help chronic conditions such as peripheral neuropathy. Okay? All right. Courses related. This is going to make more sense shortly, but taking courses on how to heal the thyroid, the effect of environmental toxicity on the nervous system and the immune system, the complex web of leaky gut, something called leaky gut, mastering functional endocrinology, hormones, adrenal malfunction, the brain and the immune axis and the gut axis, neuroendocrine immunology of liver detoxification, inflammatory and autoimmune signaling system, etc. I briefly mentioned those because, as you'll see shortly, most of you have some of these conditions and they're causing your neuropathy. So I touch on it, allowing you to understand that I've taken many courses to allow me to understand how to heal those issues. And that's going to be important to you, finding a healthcare provider that can help you with these things, okay? All right, what we're trying to do overall is teach you and empower you, okay? Power is, or information is power, right? So we want to be able to do that for you. It's worthless though if it's wrong or it's incomplete. And what I mean by that is this. I used this example. I had a patient one time with neuropathy. I went over all this that you're about to learn, and she said, well, Dr. Roni, my neurologist is Harvard trained. How can you possibly know more than him? Or why should I listen to you versus him? And I tried to explain briefly that the information that they're being taught in that healthcare system, that doctor may be the best in the world with that information, maybe one of the smartest people. But if the information is only a small piece of the big puzzle, right, then that doctor may not be able to help you as much as you think. And that's what I want to make sure you understand, that the conventional model is consistent about diagnosing and treating with medications or surgery, right? And that's not anything new that most of you don't understand, But the problem with that is, whether it's gabapentin for your neuropathy, your nerve pain, or Lyrica for your pain in general, they're not going to correct the causes of your problem. They're going to help you, right? And I'm all for it. I'm all for it short term, because God knows you have to function, and I know you're suffering greatly. So those medications I know can help you, but the point I'll make is they won't correct the neuropathy. They won't help the causes. So really, over time, the neuropathy is just going to get worse and worse, and you're just going to need more and more meds. So I want to introduce to you another concept, right? How to actually heal with this, okay? Hopefully that makes some sense. Okay, here's some big numbers here. 1993, and I just used 1993 versus the year 2018 regarding health in this country. In 93, we spent $900 billion on healthcare, and we were ranked 32nd of the top 55 most industrialized nations. We ranked 32nd, spent 900. In 2018, we spent $3.5 trillion, and we dropped 11 spots. So we're now 43rd of the most industrialized nations. We're 43rd out of 55, okay? So we dropped and spent a lot more money. Here's one of the probably the most important statistics that I'll share with you. In America, we consume 66% of all the medications worldwide, yet we're only 6 to 8% of the population. So that stat right there should tell you we possibly are doing some things wrong, or we're not getting the complete amount of information that we should, okay? Medical errors and deaths from medications. Medical errors, 250,000 people die a year, and then 198,000 from prescription med deaths. So that's a lot of people, and it ranks us towards the top 1 or 2 of causes of death of anything in America, okay? So you have to be aware of that. The US ranks #1 in the world in crisis care. So the point that I make with all that is something we're doing isn't working. So I want you to start understanding how to change your mindset a little bit so you can get better, okay? All right, so health paradigms. In the conventional model, it's an outside-in approach, right? We're gonna try to find health outside of our bodies. It's gonna be artificial, we're gonna battle disease, it's gonna be reactive care, okay? Intervening care, replaces, treats symptoms, uses drugs to resist death, chemical, treating your individual parts, and it's passive. What I mean by passive is you go to the doctor, they give you a medication, you go home, you don't take an active participation in your health, okay? That right there is why those numbers are the way they are. What we work on is an inside-out approach. We're trying to get your body functioning at a cellular level as well as it possibly can so your body can heal. That's the concept. So it's natural. We want to build health, right? We want to be proactive or preventative. We want to reconnect, restore, and here's a big one. We want to correct the causes of your problem. So with neuropathy, I'm going to show you specific causes as to why your neuropathy is there. If those are found and can be fixed, you set up your environment for healing, okay? And your nerves can regenerate, your peripheral nerves can regenerate, but they need the proper environment to be able to do that, okay? Frees nerves and uses factors of health, it's electrical. We're taking a whole body approach, not a specific organ or system. And we want you to be active in the participation of your health. You can't do it passively, okay? It's gonna take time, energy, and maybe even dollars and cents to be able to get yourself healthy, but as long as you have the tools in the toolbox, it's achievable, especially with neuropathy. Okay, so the definition of health is 100% function of the mind, body, and spirit, and not merely the absence of symptoms, okay? So that's big, because the whole idea, again, just to reiterate, is to try to get your body functioning better, okay, from the inside out, okay? Conventional care is not necessarily health care, it's more sick care. And we want to make sure you understand that. What we're going to talk about today is actually health care, okay? So just so you understand those two. As a result of proper function and healing, right, this is a big one, the liver is new every 6 weeks. Your bone cells are new every 2 weeks. Your red blood cells are replaced every 90 days. Your stomach lining new every 4 days. Skin is new every 30 days. and your peripheral nerves can regenerate, okay? However, they're only going to do that if your body is functioning at a high level. So at the end of the day, I explain this to my patients. I want your cells, the environment, conducive so your cells can heal faster than they break down. If we can create that environment, you're going to stay healthy for a long, long time, and you're probably not going to have many symptoms either, okay? Neuropathy being one of them. So the body is in a constant state of repair, and will do this well if we're functioning well, okay? I think I've pretty much knocked that one out of the park, hopefully, for you. Okay, so common causes of neuropathy. The metabolic disorders are the most common that we're going to see, and we're going to talk heavily about those. Again, these are autoimmune conditions, thyroid malfunction, digestive system issues, leaky gut, hormone imbalances, adrenal malfunction, anemia, etc. So those metabolic issues, we need to identify. If you have neuropathy, we need to be able to identify those early in your care and be able to put you through protocols that are going to actually help those conditions, okay? Statin medications are another cause of neuropathy. Statin medications for high cholesterol is a $3 billion a year industry. So a lot of our patients are on statin meds, and we have to make sure that those statin medications are not a causative factor to the neuropathy, okay? Spinal issues could obviously be with compression of the nerves and the vertebrae, compressing those nerves. We could get either down the arms or down the legs because of that. So we have to rule that out. And a lot of patients have that, so we have to treat that as well. Chemotherapy, so cancer treatment or therapies, radiation as well, can create or cause neuropathy, so I have to be aware of those. Surgical complications, alcoholism, and then diabetes is also a big one. Now, diabetes also falls under metabolic conditions, but diabetes is one of the most common causes of peripheral neuropathy. And I'll explain this in a little bit, but basically, the diabetes and the elevated blood glucose levels and insulin levels over time narrows your blood vessels and leak compounds into the nerves. So two things happen. Number one, we lose blood flow to the area, and number two, we leak toxic compounds into the peripheral nervous system, and that damages the nerves. So we also can get an autoimmune attack against something called the myelin sheath, and we're going to talk heavily about that in just a minute. Okay, so the basics of peripheral neuropathy. Problem with nerves that carry information from the brain and the spinal cord out to your periphery, your arms and your legs, for example, and then back, okay, back to the spinal cord and the brain. The symptoms depend on which nerves are affected. So we could have sensory nerve neuropathy, and that's the most common. We could have motor nerve neuropathy, which means the nerves that innervate your muscles are affected. And then we could have what they call autonomic neuropathy. Autonomic nervous system, think about it as your automatic nervous system, okay? So, which means you don't even have to think about it. This nervous system controls things like your digestive system, for example. You don't have to think about digestion, it just happens. But if you get problems or damage to your autonomic nerves, things like your digestive system are going to start to break down because the nerve supply isn't going there. But the most common, and the one we're going to talk heavily about, is what they call small afferent fiber sensory neuropathy, okay? Damage to the sensory nerves results in changes to sensation, hot and cold, touch, pressure, and vibration, okay? This can lead to inability to determine, joint position, leading to loss of balance and incoordination. So if I can't feel where my feet are going on the floor, right, I have a tendency to fall. And that happens quite a bit with neuropathy, okay? So again, sensory nerves are the ones that we're going to talk heavily about because it's the most common. Okay, so in order to determine the course of treatment, we need to understand which nerves are affected. So we have A alpha, A beta, A delta, and type C, and they're all responsible for those different sensations that we talked about. So when we do a neurological exam, we do want to find out which type of nerve fiber is affected, okay? And that's going to help us determine what kind of modalities we would use to help you. Okay, so here's the big picture of neuropathy, and I want you to understand this because this is important. Peripheral neuropathy is caused by these four main things, okay? Oxygen deficiency, decreased blood flow, decreased energy to the cell, or the ability of the energy to produce, or the cell to produce energy, and increased inflammation, okay? Those four things are why your peripheral nerves are getting damaged, which are creating the symptoms that you have, okay? That could be burning, tingling, numbness, stabbing pain, like you're walking on broken glass, right? Inability to sleep because you're getting that pain at night. These are all symptoms that will happen because of one of the, or usually with most people, these multiple issues that happen. Now, bigger picture, okay, which again leads to cell death. So if you don't have oxygen, blood supply, your tissues are inflamed, and you don't have energy coming from the cell, you're going to have cell death. Remember, we want the environment conducive so the cells heal faster than they break down. With neuropathy, your environment is conducive for the cells being damaged faster than they can heal, if that makes sense, okay? So these four things, okay, now here's a step further, are then going to be caused by the following things, okay? Remember, beginning when I talked about my experience chiropractically and what I had to learn in order to get people healing from the inside out. These things are what I started to see constantly on files, and then in the research and in my learning, these are pretty much the root cause of most, if not all, chronic diseases, including neuropathy, okay? So, autoimmune conditions, digestive system malfunction, we talked about it, chronic acute infections, chronic or acute infections. Liver is not detoxing properly. That's a big one in today's society because of the amount of toxins that we're introduced to. Anemia, blood sugar imbalance, adrenal malfunction, hormone imbalances, toxins in the system, and that's the inability of the liver to detox. Thyroid malfunction, vitamin mineral deficiencies, okay? So real quick, autoimmune. If somebody feels tired and achy and sore, kind of flu-like consistently, that's almost a red flag that there's an autoimmune condition, okay? Oops. Digestive system malfunction, leaky gut. So if you have constipation, diarrhea, if you eat and you get bloated or irritated, you have IBS, which is irritable bowel, things like that, it's pretty much, it pretty much means that you have a digestive system issue and potential for something called leaky gut, which I'll talk about in just a second. So if those things are going on, if you have those symptoms, especially digestively, it means you're not breaking down foods properly, or what they call assimilating or absorbing them. So if you're not absorbing your foods properly, you're not getting energy to the cell. And that's a big part of why you could have peripheral neuropathy. Chronic or acute infections. So infections in the body, and they could be chronic viral infections, bacterial infections, fungal infections, parasitic infections. They're so common in today's society that we test almost every patient that comes in for these infections. It's a must, because if you have chronic infections, your immune system is going to be overworking constantly, creating inflammation. And inflammation is one of the root causes of all disease, neuropathy being a big one. If we're not detoxing, right, we talked about that one. Anemia means, just briefly, that you have low red blood cell counts and usually low hemoglobin and something called iron. If your blood count is low, your iron's low, you're not getting enough blood flow to your cells, and you're not getting enough oxygen. And remember, those are two biggies on why neuropathy happens. So in every patient, we rule out anemia, and it's way more common than you might think. Blood sugar imbalances, we talked about it. It's probably one of the #1 causes of neuropathy because of what happens to the blood supply. So high insulin, high glucose levels will create a lack of blood flow to the tissue, especially the nerve cell, and create damage there, which we'll talk about in a minute. But your blood sugar imbalances, if you're not sure, if I eat and I get tired after I eat, that can be a major sign of a blood glucose imbalance, what they call hyperglycemia. If I miss a meal and I get shaky, jittery, irritable, that's a sign of what they call hypo, or low blood sugar. We see a lot of patients bounce between high and low, which means they're having blood sugar imbalances, and it sets up for those neuropathy type symptoms, okay? Adrenals are your stress glands and produce something called cortisol and adrenaline and things like that. But cortisol is one of the main ones that can create problems in your system, low blood sugar, sleep issues, etc. So if I can't fall asleep or stay asleep, that's usually an adrenal issue plus a blood sugar issue. If I can't handle stress well, it's usually low cortisol, and we have to check all those things for you. Hormonal imbalances are big as well. We see patients with low testosterone, males with low testosterone. We'll see patients on the female end with low progesterone, maybe estrogen dominance, which creates an inflammatory windup in the system, or it's a fuel to the fire. So we definitely want to look at that. Your hormones control the function of every cell in your body. So if your hormones are imbalanced, you're definitely going to have less function than you should in your body. So we have to check those. And of course, symptom-wise, could be fatigue, could be irritability, PMS. You know, if you're post-menopausal, it could just be extreme irritability, again, fatigue, grouchiness, right? Dryness vaginally, etc. So they're pretty commonly known, but they're a big deal with neuropathy. Toxins in the system, again, it could be fatigue constantly, I get achy, I get sore. These toxins are looked at by the body as foreign invaders. So the immune system will overwork trying to get rid of those. So you'll get tired and fatigued, just like if you had the flu. The thyroid's a big one. When my thyroid is low, or a person with thyroid malfunction, and it's low, it's going to reduce what they call cardiac constriction, which means you're not going to get blood flow. So a lot of people with, to the extremities, I should say. So a lot of people with thyroid malfunction have cold hands and cold feet. The reason for that, they're not getting the blood supply to those extremities because of that constriction that goes on. So the thyroid's a big deal, and it's often overlooked in neuropathy. So we have to look at that. And then of course, if your digestive system is poor and you're not breaking down foods properly, you're gonna have vitamin and mineral deficiencies, okay? So again, we have to look at all of these things that aren't looked at in the conventional model to make sure, right, you don't have them. And if you do have them, they have to get corrected so your body can function better, and we can get better oxygen, better blood flow, better energy, and we can decrease the inflammatory process. Gang, that's it in a nutshell. That's why you're having neuropathy. But if nobody's teaching you that, or talking about it, or just doing an NCV test, which is nerve conduction velocity test, and just giving you medications, of course you're not gonna understand or know. So that's what this whole video is about, to teach, right? To empower you. Okay, let me go over this and help you understand exactly what's going on. So this is a healthy nerve cell, okay? And what I want you to see is these hot dog-like structures here. They're called nodes of Ranvier. You don't have to remember that. But what happens is impulses come in, the impulses go down and jump from one node to another. They go through the end called the axon terminal, and now another terminal is lined up against it, and that's where they connect. So these nerve impulses connect from neuron to neuron, and there's trillions of them in your body, but this is just one example. When we start to get peripheral neuropathy, and I'll explain it even a little bit deeper, but these nodes of Ranvier, the myelin sheath, if you will, and I'll talk about that in a second, start to become damaged. So the impulses going down are not getting there properly. Plus, if you remember the different nerve types, A alpha, A beta, A delta, and type C, depending on what nerve is affected, what nerve type is affected, is what symptom you're going to get, okay? So these nerve fibers become damaged, creating the symptoms. Now again, let's back up just for a second. Why would they become damaged? Well, it's all those metabolic issues we just talked about. The high inflammation from autoimmunity, etc., right? We just went over that. So I just want to make sure we back up a little bit and you understand that your environment conducive to healing is not optimal, which means you're getting lack of blood flow, lack of oxygen, inflammation, and decreased energy to the cell, and that's what starts to happen, okay? Hopefully everybody's okay with that. All right, this is a nice picture because it shows in a little more detail what's happening. So this yellow is a peripheral nerve, okay? Within the nerve, you're gonna have blood supply. You're gonna have an artery, a vein, and then you're going to have these structures that are like cables, right? If I cut a cable in half, there's a lot of fibers that run through. So these nerve fibers contain individual nerves, okay? And what happens is and I'll go back for a second. Say I have diabetes and my blood sugar's been high and my insulin is high. It's going to affect the blood supply to these nerves. And if the blood supply is weakened or decreased over a long period of time, and thyroid does this too, remember, it's going to start damaging these individual nerve cells, okay? So, again, whether it's a lack of proper digestion and I'm not getting the vitamin and minerals to these nerve cells, or I have autoimmunity, which is creating inflammation to these nerve cells, or I have lack of thyroid function or low thyroid function, creating lack of blood flow again, or I have anemia, which is lack of oxygen and blood flow. Again, not to belittle or belabor a point, but these are the reasons why at this cellular level, these nerve cells start to break down. And if you're not getting those looked at, or nobody's opening that door for you and looking at those and examining those issues, this environment is going to continually be conducive for more and more breakdown, okay? So again, we've got to look at these for you, somebody does, and look at these issues or these conditions that are creating the neuropathy. Right? I think we've gotten that one pretty good. So the prognosis, understand, it's greatly dependent upon the clinician you go to and their ability to understand this, right? So in the functional med world, in the integrative medicine world, this is what we do. I would say, I tell patients this, that if you go to a doctor that is really well-versed in cause and effect, a doctor of cause is the kind of doctor that you want to go to. Somebody that has studied what causes the body to break down. Those doctors are going to help you the most, right? And unfortunately, I hate to say it, but in the conventional model, right, they don't teach them that. So it's not an individual doctor problem or nurse problem, it's a system problem. The system is teaching them certain things that they want them to know, but they definitely aren't teaching them how to heal somebody from the inside out, okay? A lot of reasons for that I won't go into. You can make your own determination, but when we consume 66% of all the drugs in the world, and we're only 6 to 8% of the population, you can conclude why that is, okay? And I'll let you do that on your own. All right, so people ask me, well, is this guaranteed? And I have to tell you, I explain this as best I can consistently in that what this does is it's one of the best approaches to minimize your downside and maximize your upside, right? So there are patients that come in that have significant damage, and you could see it, especially my diabetic neuropathies. They might have almost gangrene in their feet, or their nail beds are just almost falling off because they haven't had blood supply in many years. That's going to be a tough patient to help, okay? However, I still would encourage them to get their body functioning as well as they can so it doesn't continue to get worse, and we hope for the best. But for most people, okay, it's not that bad, and the examination can tell you kind of how bad things are, and somebody with experience will be able to tell you fairly quickly, oh no, there's a lot that can be done, or it's pretty aggressive or pretty bad, and then the outcomes are just dependent upon what you bring us, basically, right? So we're really honest in the evaluation process and what outcomes can be, I guess, predicted based on how severe your conditions are. So nothing's guaranteed, right? You go to the oncologist and they treat you for cancer, they're never going to guarantee anything. So I just want to make sure you understand the bottom line is get your body functioning as well as it possibly can, allow your body to heal as well as you possibly can, so you minimize your downside and maximize your upside. Okay? I hope that makes sense. I hope that's fair. I don't think anybody should tell you anything different. If not, I believe they might be telling you a story. So it's the best way to minimize, right? Minimize and maximize. All right, so what's the solution? Let's wrap this up and give you something to take away here. All right, so number one, when a patient comes in, I'll kind of walk you briefly through the process. We have them send in all the paperwork that we ask them to fill out. The paperwork is very specific to those metabolic conditions. So it really goes in order. We ask them questions about their colon, their small intestine, their stomach, their liver function. Then we ask them questions, I should say, about their blood sugar, and we ask them about their thyroid and their adrenal glands and their hormone balance, etc., right? Their autoimmune conditions, inflammation. And once we get that information, we can basically take somebody, this concept of from the Pacific Ocean, where we know nothing, to a puddle of water this big. So the paperwork really helps us dial in where your problems could be or where your causes could be. Of course, there's an evaluation process for your nerves too, and any diagnostic test that we want to do. So the number one thing though is we want to identify what causes you may have, do testing for those to rule them in or rule them out, and then once we get all that data back, we can put together a step-by-step plan, or a doctor that understands this real well, I should say, could put together a step-by-step plan to be able to then start working on your anemia if you have it, your autoimmune condition if you have it, your digestive system disorders, your thyroid. So all these things using what we call science-based nutrition, right, can be helped, and the conditions can actually be healed. Now, if we get those conditions better, okay, by this approach, at the end of the day, in your environment, in your cellular environment, better blood flow, better oxygen, less inflammation, better energy. Now you have an ability of the body to heal properly, okay? And a lot of patients then can start coming down off of their meds and reducing them because their body's actually functioning better, and the damage to their nerves is decreasing, and the inflammation to those nerves, which is a big cause, is actually decreasing, okay? Better function, better environment, ability to heal. Can't summarize it much better than that, and hopefully that makes a lot of sense. But, or I should say, and there's other things, especially here at the Center for New Medicine, that we can offer you that I think are phenomenal, okay? There's something called beamer therapy, hyperbaric oxygen therapy, cell sonic therapy, ozone therapy. These are modalities that are proven increase blood flow, increase oxygen, decrease inflammation, increase energy. Proven. So we also integrate these into a care plan for neuropathy, okay? And they work phenomenally well. But I will tell you, it can't just be those things. It has to be a combination of cause, getting the causes right, and increasing your oxygen, blood flow, energy, and decreasing inflammation with these modalities. If we do all those things, there's not much else, right, that leave no rock unturned. There's not a lot else out there research-wise that we can pull from. This is pretty much it. We're maxing it out. So the outcomes are very, very good because we leave no rock unturned, okay? Hopefully you gathered that by now. All right, so there's also, I put in there chiro care because we have a lot of patients with compressed nerves, disc degeneration, things like that. So again, we don't want to leave anything out of the picture that could be potentially a cause and not correct it or help it, okay? Because we won't get the best outcomes that way. And then I always give home therapy for patients to help stimulate some of those nerve fibers, the A alpha, beta, delta, and type C, okay? All right, so finally, and I'm talking quick because I didn't want this to be too long, right? Because I know you probably get tired and you're in pain and sore and all that. So I'm trying to talk a little quick, but you can go back and rewind it. I found that out. Funny. Anyway, so let us evaluate your situation, or somebody evaluate your situation. If you're interested and you need help from us, right? I want to give you that opportunity, okay? Because I know answers sometimes can be few and far between. So if you do need help, you can find a clinician that does this, right? Or you can come to us and call 949-680-1880, and we'll help you any way we can. The girls at the front desk, guys at the front desk will be able to answer questions, schedule you for an appointment if need be, and then we could start the process. First step, they'll tell you though, is get the paperwork in, and they'll direct you to all this. Paperwork in so we can evaluate. Once we evaluate, then we can bring you in, and then we could set up, if there's testing that needs to be done or lab work that needs to be done, we could start taking that road, okay? But at least it gives you a path and an opportunity to try to get well, okay? Hopefully you learned something. I know, again, it was quick, but I hope that you were able to learn something and get information that you actually can use to help get your neuropathy better, okay? Any help you need, let me know. Be happy to help you, okay? Good luck.